Hello, how are you? Did you know that you could be increasing your risk of stroke, heart attack, or kidney stones by drinking water the wrong way or at the wrong time? A lot of people don't know this, and it's super important to talk about it. Stick around until the end because you're going to love this video. It's really important and could even save your life. Before we start, I want to ask, how old are you and where are you from? And how is your water intake? Is it something you keep track of throughout the day? Or is it something you just do whenever you feel like it? Do you barely even remember it during the day? Is it something that's pretty easy for you in that sense? Let me know down below. And actually tell me too, what's the drink you consume the most? Is it water or other beverages? That's also super important for us to talk about. And while you're at it, leave a like on the video because that really helps me out here on the channel. And if you know someone who needs help with this topic, with water and other liquid intake, share this video. Let's you and I expand this chain of good. That's what I want here with the channel. We know that very few people drink water regularly throughout the day. Many people wait until they feel thirsty to drink water. And this habit of waiting to feel thirsty before drinking water can actually be dangerous, especially for older people. Thirst, in fact, is a late sign that you're already becoming dehydrated. In the brain, we have the hypothalamus, which is an area that only triggers the thirst alert when plasma osmolality has already increased. That is, when the blood is already thicker, more viscous, due to water loss. This blood ends up becoming more viscous, increasing the risk of forming clots. This can lead, believe it or not, to a higher probability of heart attack, thrombosis, and even stroke. In fact, when the body doesn't receive enough fluids, the blood becomes thicker and circulation slows down, which can further increase these risks. That's why, in elderly people who have a slower thirst reflex, the danger of silent dehydration can be even higher and often goes unnoticed until it's too late. That's why for the elderly, we need to offer them water more often throughout the day and not wait for them to ask for it. You have to offer them water and liquids all the time, remind them to drink. Even if they don't like water, you can give them other types of liquids or drinks that hydrate or foods that hydrate so they always stay hydrated. Besides the issue of how much water to drink, many people consume water in the wrong way. There are people who wake up and don't drink water, maybe have a little water in the morning or at lunchtime, and then go the whole day without drinking any water. They often feel thirsty at night and drink water before going to bed. Sometimes this happens a lot at night. I don't know if it happens to you or to someone you know. And then you spend the night getting up to pee, sleep poorly, and this also ends up becoming a risk factor for cardiovascular problems, heart attack, or stroke. Because you keep waking up many times during the night, you don't get restorative sleep. Everything gets really out of balance. Remember that ideally, when you wake up, you should drink a glass of water right away, or two if you're very dehydrated and very thirsty. Keep drinking water throughout the day. And also remember that ideally you should drink water a little before lunch, a little after lunch, an hour after lunch, during your afternoon snack, and before dinner. And remember that foods can also hydrate you, like cucumber, zucchini. Then there's tomato, watermelon, melon. These foods naturally have a high water content and they are also hydrating. So they are great sources of water and electrolytes, which will help your body retain more of that water. So, vegetables, greens, and fruits will also help you stay hydrated in a healthier and more balanced way. We know that dehydration can really affect our brain and our mind. When we lose just 1 to 2% of water in our body, it can already impair our concentration, our memory, and even our mood. In the kidneys, more concentrated urine will cause greater crystallization of mineral salts, which can lead to the formation of very painful kidney stones. Nobody wants that. The intestines will have harder and drier stools, and this can increase the risk of constipation and hemorrhoids. So, if you tend to be more constipated or have drier stools, staying hydrated is extremely important. And for the heart, it will have to work harder to pump blood. Because remember I told you that the blood gets thicker? So this will increase your cardiovascular risk. So, if you have high blood pressure, or if you are someone with cardiovascular risk, keeping yourself hydrated becomes even more important. So always staying hydrated, having a water bottle by your side becomes even more important. It's worth talking about the issue of pure water versus other drinks. Of course, water is the preferred liquid. That's why I asked you at the beginning what you drink more of, water or other beverages. So we know that 60% of our body is made up of water, right? And it's used for many vital functions. So obviously the ideal would be for you to drink more water, but water is also present in coffee, tea, juice, But that caffeine also stimulates diuresis, so you end up drinking water, but it doesn't stay retained in your body. Be careful with alcohol because it also stimulates diuresis. It inhibits vasopressin, which is a hormone that retains water, so it causes dehydration. Also be careful with the water you drink that has a lot of sugar, like juice, soda. Many people end up saying, oh, I don't like to drink water, but then they drink soda, boxed drinks, even a natural fruit juice that's super concentrated in calories, has a very high glycemic index, causes glucose spikes, insulin spikes, which ends up not being healthy for you. The caloric concentration is high, it can lead to weight gain, metabolic problems, so that's not ideal. Of course, it's totally different if you have a lemonade sweetened with stevia or a drink you make with a portion of fruit and add a big glass of water. That would be a much better option. For those who don't like water, a flavored water works really well. With a few slices of cucumber, some lemon slices with mint. These can be interesting options for offering flavored water to those who don't like plain water. Now, drinking a lot of juice instead of water throughout the day is not a good option. Of course, we lose water and electrolytes in our daily lives, and our own water intake and diet already normally replenish these, as long as we pay attention to this in our daily routine. Of course, if we live in a very hot place, if we exercise a lot or sweat a lot, if we've had a fever, diarrhea, or any kind of severe vomiting, we may have lost more fluids than we realize. In those situations, the body becomes dehydrated much faster, and if those fluids aren't replaced promptly, the risk of dehydration can be significantly higher. It might be necessary to do oral rehydration or even intravenous rehydration. So, if you've experienced a significant loss of fluids, it might even be necessary to see a doctor because as we age, and also for very young children, at both ends of the age spectrum, right, we become more sensitive. So, in any case, it's very important to see a doctor, consult a specialist if you think you're very dehydrated. As I told you, it is indeed dangerous for our health. We can't take this lightly. Always keep that in mind. Think about your health and your safety. How is your water intake? How many times a day do you drink water? Do you usually keep a water bottle by your side? Are you always refilling it? That's very important. Tell me more about it in the comments. I'd love to see your comment. Remember to like the video because that really helps me out here on the channel. And share this video with anyone you know who will enjoy it and with those who need it. Let's work together to grow this chain of good. That's what I want here with the channel. See you next time. Bye.